Hi, and welcome to another video from the CTAD Clinic. My name is Dr. Mike Lloyd and I'm the clinic director. Some years ago I was asked by somebody with Other Specified Dissociative Disorder, also known as OSDD, what it sounded like in my head. They were obviously experiencing an awful lot of sort of chaotic conversation, sort of emotional content sort of being thrown at them, a variety of sort of verbal and non-verbal different sort of sounds and experiences. And they're really experiencing what they considered to be a sort of a cacophony of noise that really made everyday life extremely difficult. And they're interested in what it was like inside my head, because I seem sort of calm and obviously I don't have OSDD, so I wasn't hearing the same sort of content that they were hearing. And they asked me to describe it, and I think the best way that I did was to simply stop talking and sort of offer them 10 or 15 seconds of what was going on in my head through the external sound. So I thought the best way to do that would be to be here on the outside in the clinic grounds, just to give you a bit of a sense of that. It's a bit of a windy day, there's a few things going on. So I'm going to offer sort of 10 or 15 seconds of sound to give people an understanding about what it's like in my head in terms of what I hear on an everyday basis. So here we go. Okay, so hopefully what's been heard is just the sounds of the environment, because realistically that is what goes on in my head the majority of the time. I can have thoughts, and I can have anxious thoughts, and I can have calm, happy thoughts, and those don't really sound like anything. But when I'm not having thoughts, all that's going on inside my head is the sound of whatever's happening to be on the outside, and I tend to respond to that. So I'm either listening to it or ignoring it, depending what it is. So if I'm watching TV, then it's just the sound of the TV. If I'm listening to the radio, it's the radio. If I'm just sat in the garden like this, hearing nothing, there is nothing going on inside my head. It's a completely empty space, and that's a good place for me to be. So that means that I'm calm and I'm regulated. There isn't an awful lot going on, and I'm just listening to basically this, which might be a plane in the sky, birds, the wind rustling in the reeds, whatever it might be. And she was really kind of upset by this, because it sort of felt so alien to her, and that she really wanted this sound. So the client was saying to me, what is it that I can do to achieve this? And I said, well, okay, given that we've got a reasonable amount of regulation and reasonable amount of collaboration and communication between you and the internal system of OSDD, what we're going to do is an experiment. So this isn't something that I would recommend people to do outside of therapy at all. This was simply an example of something that was done within a therapeutic setting. So we were very supportive and the client was very well regulated. But it's an example of a place that people with OSDD can get to, if they want to, using therapeutic support. And what we did was, I went to the internal system and I spoke to the various parts that I'd already had some sort of sense of understanding with, and I asked them to give this client, give the patient some space at some point between this therapy session and the next therapy session. So basically sort of take a holiday from being noisy or from on offering content, just to take a break, to offer the patient an opportunity of giving her some understanding of what it would be like to not have OSDD. And in fairness to them, and this was quite a way into therapy, so they were very, very good. They seemed very interested in this. And the client went away and was like, this is never going to happen. I'm just going to be stuck with this for the rest of my days. That's all I've got. And when we came back to the next therapy session and I said, how did it go? She was really, really distressed. And I was kind of like a bit confused as to understanding what. So I said, okay, so it clearly hasn't happened at all then. And it's obviously got worse and what have you. And you know, trying to make some sort of sense of it. And she said quite the opposite. It's been dead silent inside my head and I hate it. And I was really surprised by this, because firstly, the internal system, all the parts and the various alters within the system, they all just kind of took a breath and sort of just vacated the premises for about 2 days. And this lady had this silence in her head, possibly for the first time since she was an extremely small child, because she'd been suffering from this ever since early childhood. And she couldn't bear it. She couldn't bear the sound. She couldn't bear the emptiness. She said it felt like just this gaping space, this sort of abyss this absolute vacuum of the void of nothing, and it felt horrible and alien to her, and she couldn't stand it. And then when the parts started coming back in after those couple of days, she was almost relieved to hear them. So even though it was a bit of a strange experiment that we ran, it was successful. It worked in a way that we didn't expect, because what ended up happening was she started appreciating and being grateful for the noise that the alters were offering. And eventually we moved to a place where the sort of the content that was being offered was a lot more supportive and a lot more straightforward and easy for her to take on. So what it showed was that the space inside the head of someone with OSDD, like this patient, sort of needed to be filled, because she couldn't cope with the emptiness, because the emptiness started taking her to places that she didn't want, so trauma memories and things like that. So that space wasn't good for her in a way that it absolutely is good for me. And this shows the real difference between the sort of the OSDD, the dissociative mind, and the non-dissociative mind, i.e. my own, and really sort of how we appreciate and how we understand the kind of space that we're offered and that we're given. So I thought it'd just be a really nice example to give to people today. So again, I'm not suggesting that people try this out without some therapeutic support, because who knows what could happen. I was entirely surprised. It's a sort of a unique and individual response. So it needs to be understood, it needs to be supported, and obviously good therapeutic support is the way to go about that. But what it does show is that we don't always know exactly what an experience is going to be like until we get there, and we have to be prepared for the unexpected when it comes to these kind of experiences, and certainly within therapy with these kind of changes. But it was a really interesting moment for her and it kind of galvanized some movement within the OSDD system and how she started working with and appreciating the parts within that system. So I thought it was definitely worth sharing with you as a case example of some form, but also just as a way of being able to sort of understand what the internal experience of my mind, the non-dissociative mind, assuming I'm fairly straightforward and ordinary, which I think I am, that this is probably what most people who are not dissociative and traumatized are experiencing. So I hope that's been useful. Really look forward to reading the contents. Really look forward to hearing the comments and see what people think about this video, because it is one of those things that it sort of gives us an insight. And I've done a few of these what it's like to not be videos, and those have been quite well appreciated. So I thought I'd put another one down, and then obviously I can do more as we go along. So yeah, thank you very much for watching. But what I'm going to do is I'm just going to offer a little bit more time here, just another sort of 10-15 seconds or so, just so that there's an additional experience, if people are still listening and watching this video, to have a sense of what's inside my mind. Because even though I've been talking and this kind of stream of consciousness working through, the silence is still there. It's just simply my voice. My thoughts are turning into my voice, and I'm speaking, and here's what's going on inside my head when I'm not speaking. And that's great. And I can hear some of the ducks in the distance sort of like quietly gabbling away, which is a really nice. So for me, this quiet, peaceful time is an extremely good place for me to be. This is often why I come and sit out in the grounds of the clinic and really sort of just take this space, because it absolutely regulates and calms me in a way that for many traumatized people, it absolutely does not. So thanks for watching. Please put the comments down, do all the usual like, subscribing, and I will continue making more content for you. And in between now and the next video, as always, please do take great care.